The cost of promiscuity. Discover the 10 most dangerous STDs, their symptoms, tests, treatments, and how to protect yourself. Picture this: you're living your life, enjoying freedom and pleasure, when suddenly your body starts sending warning signs. An itch that won't go away, a strange spot, a fever out of nowhere. Fear grips you. Anxiety builds. Everything that once seemed harmless now feels like a nightmare. And then the question hits: were you careful enough? The truth is harsh. Sexually transmitted diseases, STDs, are far more common than most people realize, and symptoms can often be silent, taking weeks or even months to show up. This invisibility creates a false sense of security. But believe me, the cost of promiscuity can be higher than you ever imagined. Let's dive into the 10 most dangerous STDs, their alarming symptoms, how they're diagnosed and treated, and most importantly, how you can avoid them. 1. HIV/AIDS. HIV attacks your immune system, and without treatment, it can develop into AIDS. The scariest part? It can take years for symptoms to appear, silently spreading inside you. Symptoms include fever, extreme fatigue, and unexplained weight loss. Blood tests can diagnose the virus, and while antiretroviral treatments can manage the condition, there's no cure, only a way to control its progression. 2. Syphilis. Syphilis is sneaky. It starts with a small, painless sore, but if left untreated, it can attack your brain, heart, and bones. Early symptoms include skin rashes, fever, and headaches. Diagnosis is done through blood tests, and treatment typically involves antibiotics, usually penicillin. 3. Gonorrhea. Known for causing painful urination and abnormal discharge, gonorrhea can be silent in women, making it especially dangerous as it often goes unnoticed. If untreated, it can lead to infertility. Urine tests and swabs from the cervix or urethra are used for diagnosis, and antibiotics can cure the infection. 4. Chlamydia. Sometimes called the silent disease, chlamydia often shows no symptoms but can cause irreversible damage like infertility and pelvic infections. When symptoms do appear, they may include pain during urination and unusual discharge. Diagnosis is through urine tests, and antibiotics are the go-to treatment. 5. HPV, human papillomavirus. HPV is one of the most common STDs and can cause genital warts, but the real danger lies in the strains that lead to cervical, throat, and anal cancers. Pap smears and HPV tests are used to detect it. While there's no cure, the HPV vaccine can prevent the most dangerous strains, and warts can be removed with cryotherapy or laser treatments. 6. Genital herpes. Once you have genital herpes, the virus stays with you for life, with recurring painful outbreaks. The virus causes blisters and itching in the genital area. Blood tests and tissue samples confirm the diagnosis. Antiviral medications help control flare-ups, but there's no permanent cure. 7. Trichomoniasis. This STD causes itching, irritation, and a foul-smelling yellow discharge. Though easily treated with antibiotics, many people don't know they're infected, making it highly transmissible. Urine tests or vaginal swabs are used to diagnose it. 8. Hepatitis B. This virus attacks the liver and can lead to cirrhosis or liver cancer. Symptoms may include fever, jaundice, yellowing of the skin, and body aches. Blood tests are used for diagnosis, and antiviral medications are part of the treatment. Vaccination can prevent infection. 9. Donovanosis. Although rare, donovanosis causes painful genital ulcers. Left untreated, it can destroy genital tissues and lead to life-threatening complications. Diagnosis is done by examining tissue samples from the sores, and antibiotics are necessary for treatment. 10. Chancroid. Chancroid leads to painful sores on the genitals and swollen lymph nodes. Laboratory tests confirm the diagnosis, and antibiotics are used to treat the infection. If ignored, it can cause permanent scarring. How to protect yourself. The most effective way to protect yourself? Prevention. Consistently using condoms is essential, but so is getting regular screenings, especially if you or your partner have had multiple partners. Vaccines, like those for HPV and hepatitis B, are critical tools in fighting these diseases. And don't forget, open, honest conversations about sexual health with your partner are key. Treatment. Luckily, many STDs can be treated, but early diagnosis is crucial to avoid serious complications. If you notice anything unusual, don't ignore it. Seek medical attention, get the necessary tests, and follow through with treatment. Now, be honest with yourself. Are you really willing to risk your health, or will you take control and live without fear? The cost of promiscuity is simply too high. But the good news is, with smart, responsible choices, you can avoid these life-altering consequences. If you found this information helpful and want to keep protecting yourself with valuable content like this, don't forget to like and subscribe to our channel. We tackle the topics that truly matter to your health because at the end of the day, taking care of yourself is the ultimate form of self-love.